Dear doctors all over the world, here is my lecture about autoimmune hepatitis. If you didn't subscribe until now in my channel, try to do so. Autoimmune hepatitis is an autoimmune liver injury with female to male ratio 4:1. So this disease is like other autoimmune diseases, is more common in females than in males. It's classified into type 1 autoimmune hepatitis, type 2, and there is type 3 autoimmune hepatitis. And this occurs according to the presence of O2 antibodies. Where in type 1 hepatitis there is increase in the anti-nuclear antibody and anti-smooth methyl antibody, while in type 2 there is increased levels of anti-liver kidney microsomal antibody, and type 3 it is characterized by increase in the levels of soluble liver antigen antibody, SLA, or soluble liver antigen antibody. So again, autoimmune hepatitis is an autoimmune disease characterized by chronic inflammatory hepatitis, and it is mainly a disease of females as it is an autoimmune disease. Type 1 autoimmune hepatitis and type 2 and type 3, this occurs according to the antibody produced by the plasma cells. And when we take a liver biopsy, this is the hepatocyte, there is infiltration by lymphocytes and plasma cells. This is called lymphoplasmacytic interface hepatitis. This is called again lymphoplasmacytic interface hepatitis. What are the clinical manifestations of autoimmune hepatitis? It may be asymptomatic in 25% of cases, and it is only discovered accidentally. With routine follow-up of the liver enzymes, it is markedly elevated. It may be present acutely with acute fulminant hepatitis, in 25%, and this is very dangerous. However, there is marked elevation of the liver enzymes. There is also prolongation of the prothrombin time and may be disturbed at conscious level. 3. It may be manifesting by fatigue and nausea and weight loss, which are non-specific symptoms, and may present classically with jaundice and be resistant itching. Jaundice is a yellowish discoloration of the sclera and occurs when the serum bilirubin is more than 2.5 mg%. And this autoimmune hepatitis and chronic inflammation may lead to finally to liver cirrhosis. This liver cirrhosis will lead to decompensated liver, which may be vascular decompensation, the patient presenting by esophageal varices and attack of hematemesis and melena, or maybe cellular decompensation and the patient presented by ascites, which is excessive accumulation of fluid within the peritoneal cavity, lower limb edema, or hematemesis, it is vascular decompensation. As a quick recap, autoimmune hepatitis is an autoimmune liver disease characterized by chronic inflammation of the liver due to production of O2 antibodies and infiltration by B lymphocytes. It is mainly a disease of females, 4:1 the female to male ratio, and it is classified according to the antibodies produced into type 1 autoimmune hepatitis, where the predominant antibodies are the anti-nuclear antibody and anti-smooth muscle antibody, ANA and asthma. Type 2 characterized by the production of the liver kidney microsomal antibody, and type 3 is by SLA antibody. Let's write it now. Is soluble liver antigen. Soluble liver antigen antibody. This is called type 3 autoimmune hepatitis. It may be asymptomatic where the patient is only accidentally discovered, and this occurs in 25% of patients. Acute fulminant hepatitis, which is a life-threatening condition and may warrant and need liver transplantation in some cases, fatigue, nausea, and non-specific symptoms, jaundice and itching, and it's a typical presentation. And with time, there is chronic inflammation, chronic liver fibrosis, and formation of regeneration nodules and liver cirrhosis, ends by liver cell failure, presenting by ascites, lower limb edema, and hematemesis. There is a question now, which is very common question in exams like the MRCP or the United States medical license examinations. What are the extrahepatic manifestations of autoimmune hepatitis? Number one, it is associated with Hashimoto thyroiditis, which is an autoimmune disease of the thyroid gland characterized by autoantibodies against the thyroid follicles. These antibodies are the anti-thyroid peroxidase antibody, the anti-thyroglobulin antibody. And there is a common association between autoimmune hepatitis and Hashimoto thyroiditis. The second one is collagen vascular diseases. It is an autoimmune disease. So it may be associated with rheumatoid arthritis, Sjögren syndrome. What's Sjögren syndrome? Described in under the video. Sjögren syndrome. The question in this lecture is what is Sjögren syndrome? Rheumatoid arthritis. It is also associated with inflammatory bowel disease or ulcerative colitis and Crohn's disease, and autoimmune small intestinal disease called the celiac disease. And also there is association with other autoimmune liver diseases. And here is a question. There is a syndrome called the overlap syndrome. The overlap syndrome is overlap between autoimmune hepatitis and the autoimmune cholangitis. It is characterized by the same manifestations of autoimmune hepatitis plus positive anti-mitochondrial antibody. It's called overlap syndrome. Let's go to the investigations. The liver enzymes, the alanine transferase, ALT, aspartate transferase or transaminases, ACT and ALT will be markedly elevated, more than 10 upper limit of normal. There is hypergamma-globulinemia with increase in the immunoglobulins, especially immunoglobulin G, more than the upper limit of normal. There is positive antinuclear antibody in type 1 and anti-smooth muscle antibody in type 1, and in type 2 positive liver kidney microsomal antibody, type 3 SLA. And if we go to liver biopsy, there is lymphoplasmacytic infiltration, or what's called lymphoplasmacytic interface hepatitis. It's a disease of exclusion, and you should exclude other causes of hepatitis. There should be negative viral hepatitis, which is hepatitis A, hepatitis B, hepatitis C, and there is negative muffled, which means metabolic associated fatty liver disease, or the old name non-alcoholic steatohepatitis. There is negative Wilson's disease, which is excessive copper deposition within the hepatocytes due to a problem in a gene called the ATP7B. And drugs history, there is no drugs can cause this liver injury. The final word here is what is the treatment of autoimmune hepatitis. Number one is prednisone or prednisolone, 30 to 40 milligram per day, and this is the starting dose and should be reduced after this, what's called the steroid tapering, after 4 weeks of therapy. Azathioprine with a dose of 2 milligram per kg per day. Thank you so much. Follow me on my channel and subscribe